Hello po and magandang hapon, may panapon po kay Kongan. Welcome back and this is the part 2 po ng naputol po nung isang gabi last Saturday which was COVID positive ako. Help me, doktora. So ngayon po, hindi na lang COVID positive ako, naging COVID positive na kami. Yun ako kasi pamilya na po. So this is part 2, what to do if you and your family are now COVID positive. Okay? So my name, Dr. Anna York Bondoc. I am an internal medicine specialist po. I'm a graduate of the University of the Philippines. I am also po a pulmonary and critical care specialist. I graduated po from the US and I am a diplomate and licensed to practice in the United States. Umuwi ako sa Pilipinas where I became a 3-term congressman. I am presently the wife of a mayor, kaya ho talaga mga barangay matters itanong mo sa akin, alam ko yan. And also the mom of an 8-year-old. So today, ang dami namin na po natin, 10,000 a day na po tayo na pa-positive. So kung isa po kayo or if you have friends, you have relatives who are part of the 10,000 or you just want to know what to do, join us po at pag-usapan po natin yung topic na COVID positive kami, what to do. Okay? So basahin ko po, no? I'll just read po. Okay. The letter that I got is, Dear Doktora, ako po ay nagtatrabaho sa isang opisina at 3 po kaming nagkasakit ng COVID doon. Ngayon, kinalulungkot ko pong sabihin, yung buong pamilya ko, my husband, mga bata, at yung tatay kong senior ay nilalagnat na rin po. I think they are already COVID positive. Help me, doktora, at ano po ang advice na mabigay niyo sa akin? Well, unfortunately po, totoo po itong sinasabi po ng ating letter writer. And the trend now po talaga is, kung dati po, one person would get COVID at pag-uwi po sa kanyang bahay, maybe he would infect 1 or 2 persons in their home. Nakakakita po tayo ng mga phenomena ngayon na isa po ang na-COVID, probably from the office, from eating outside, from attending a party. Pag-uwi niya po sa bahay, nakisalamuha po, of course, with the persons in the house. Yun po ang tinatawag nating household contacts. And suddenly, the entire house is positive. Paano po yun? How did that happen? And bakit po dati, isa o dalawa lang ang nangahawa? And ngayon, we are seeing entire families. Well, I would say 2 reasons din po. No? Number 1, I believe hindi na po ito yung dating COVID. What is the meaning of this? Ang pakiwari ko po, kasi sobra na pong nakakahawa. How would I say na sobrang nakakahawa? Well, dati, kung positive kayo, then umuwi kayo sa bahay nyo, ang makakawaan nyo po ay 1 o 2 tao lang. Very rare po yung buong bahay. Ngayon po, pag nakawaan nyo po yung bahay nyo, biglang lahat. So, ang nung meaning nito, may nag-iba po doon, and I would say po, no, that these are the variants at work. Ano bang variants? Matagal na po natin pinag-uusapan. Ito po yung mga mutations ng COVID na nalaman po ng ating pong mga scientifico at dalubhasa na these mutations are more infectious, mas nakakahawa, mas matindi ang pagkakahawa. So from a previously 1 or 2 na nakahawaan, ngayon po buong household na po. And of course, the second issue po, kung bakit po mas marami pong nakahawaan, well, mas marami pong nagiging positive talaga. Whether it is a combination po of government neglect or pandemic fatigue, or talaga pong dati ginagawa ko naman, kumakain ako sa opisina, ngayon bakit bigla akong nakawa? Again, it is due to the variants and not wearing po a mask in a group of persons or when interacting with one person. So yun po yung dalawang dahilan. I would say po, if your entire family is found to be COVID positive, malaking problema po ito. Bakit? Well, from a practical standpoint lang po, no? Of course, pag nagkasakit kayo, you need, sino mamamalengke? Lahat po kayo will be quarantined, okay? Number 2, who's gonna go to the bank? Number 3, who's gonna go to Mercury Drug to buy your gamit? Of course, pwede naman hong magpa-deliver, but again, you might not have cash on hand. So talagang malaking problema po talaga ang buong pamilya. And I have heard stories po na magkakatabi po silang kama sa ICU, especially if there are seniors, it is very, very big problem. So, I'm sorry to hear this to our letter writer. Yes po talaga, I would say na nagiging pamilya na po because mas nakakahawa po ang COVID ngayon kaysa sa dati. And ang solusyon lang po nito is to be more careful when outside the home. Kasi kung wala naman hong magdadala ng COVID sa loob ng bahay nyo, di wala ring mahahawa, di ba? So again, it is the actions po of the person who is leaving the house. Number one, nagsuot ba kayo ng mask talaga 100% of the time? Hindi nyo tinanggal yan kahit na pumunta kayo sa CR, etc. You did not. Number two, sana you did not eat together with other persons po, like sa office nyo, nakipagkwentuhan, ganun po. The point of eating is the most dangerous point. At nung kayo po ay nahawaan, nadala nyo po yun sa bahay nyo, and that's how your house became positive. Okay? So, yun po yun. That's the advice that I can give. You really have to be really careful ngayon. Ako, normal care inside the house, but sobrang extra care outside the house. Kasi kung hindi nyo po dadalhin yung virus sa loob ng bahay nyo, di hindi po mapapositive yung mga tao doon. So again, if you love your family, and I know the Filipinos are family-centered, if you care for your senior mom, if you care for your senior dad, at kasama nyo po sila sa bahay, talagang kailangan po kayong mag-ingat. Okay? So sige, thank you so much. And siguro, I don't want to discuss all the topics. I'd rather take it question by question. So sige po. Marami po tayo na leftover na questions from last Saturday kasi ginabi na po tayo at hindi ko na po talaga makita yung screen. Kaya po nagkaroon tayo ng part 2, but the part 2 today is no longer COVID positive ako, pero naging COVID positive kami. Maramihan na po ang problema ngayon. Okay? So, do we have the questions, Miss Reina, that
Yes,
people sent last time?
Okay po. Before I read the question, Doctor, I just like to acknowledge the 135 viewers that we have today. And I would like to convince convince everyone, share nyo po ito if you think you care for your for your loved one. Please share this, and we might give some tokens for our share, especially dun sa mag-share ng ating YouTube channel po.
Yes, I'm sorry, hindi ko po nasabi, no? We do have a YouTube channel. Please like and subscribe. The name po of the YouTube channel is Dr. Anna York Bondoc. Doon po namin linalagay po yung mga replay. So kung hindi nyo po napanood dito, then you can always check it out doon sa YouTube. Okay? At kung meron po kayong kilalang positive or na-positive or natatakot maging positive, ito, panoorin nyo po ito. Okay? And you are also very welcome to put down all questions, COVID or non-COVID. Sasagutin po namin to the best of our ability. Okay?
Yes po. Okay po, Doctora. Here's our first question from the from our previous episode po. From one of our viewer, na COVID yung driver namin. Who should quarantine?
I think I answered this already, ano? But
Yes.
I'd like to answer it again briefly. Ang pinaka-importante, I always tell this, andito yung driver ko naglilinis. But I tell you this, the most important person na is the driver. Talagang the driver. At sabihin ko po sa inyo ito, sa Makati Med, during the first vaccination campaign po nila, so binakunahan po lahat ng doktor, ano? But they were offered one other person. And majority of the persons brought their driver. Not even yung asawa nila. Ang tilala nila rin yung driver nila. Okay? So they love their driver more than their asawa. No, I'm serious.
Not in a malicious way po.
Yes, not naman ganon. But practicality lang, 'di ba? Kasi why is the driver the most important? Kasi we spend a lot of time in the car. We are commuting. Like it or not, mainit talaga. Number 3, bubuksan talaga natin yung aircon. Wala talaga makasurvive na Metro Manila na wala aircon ngayon. And number 4, yun po yung circulation talaga. Okay? Ang dami ko na pong kilalang driver ni Vico Soto namatay, driver po ng kaibigan ko namatay, na-COVID po yung family nila from the driver. So, eto lang kung talagang kaya nyo, ibayaran nyo na hong stay-in yung driver. Kung kayo po yung driver, please totally mag-ingat kasi hindi lang ho kayo yung ma-infect but everyone na minamaneho nyo po. So actually, the point person po talaga na importante sa mga empleyado, not even your secretary, not your accountant, lahat yan pwedeng work from home. Driver po talaga eh. Kasi pati pati cook pwedeng mag-order na lang eh. But driver is important.
Ako, doktora, idadagdag ko dyan, ang kasambahay ko. Siya kasi ang tagalabas namin eh.
Pwede rin.
Lumalabas, runner namin. So, if I would have
True.
to, yes.
Yes, definitely take care of your kasambahay also. Kasi parang treat them as your family. Ganon.
Okay, from Mr. Eusebio Bondoc. This is our viewer last time on our YouTube channel. What to do if you're COVID positive? Isolate at a quarantine facility. Inform barangay officials so they can do track and trace the people you have had contact with.
Alam mo, nalaman ko si Sir pala, si Mr. Eusebio Bondoc, is based in the UK. Dun sa mga comment niya, sinabi, he explained the situation po sa UK. Tama po yung sinabi ni Sir, no? The first thing that you need to do is don't panic, okay? Number 2, inform the barangay officials. Hindi po para maltratuhin kayo, pero para i-assist kayo, okay? That is called the Barangay Health Emergency Response Team, or kaya BHERTS eh. Opo. After that, kung kayo po ay isa-suggest po nila na pumunta kayo sa government facility, please go. Baon nyo na lang ho lahat ng kailangan nyo. Sa amin ho, ito lang sabihin ko. The government facility will pay for your food sa amin. Tapos meron ka pang 14 kilos of bigas. You can bring all the unans that you want and there's a bed there. And guaranteed pong malinis. So, we really encourage persons to leave the house primarily para hindi na ma-infect yung mga tao sa bahay. Unfortunately, sa Metro Manila, hindi po linalabas yung mga tao sa bahay. I don't know why. Baka naman sobrang dami na sila. I do not know why. Okay, I cannot speculate eh. Baka naman ayaw nila sumama. But really the best thing to do, and this work in Wuhan, China, i-separate yung positive from the negative. And that is what we call isolation. Okay? Eto pa rin na, Diyos ko, nalaman namin. Eto nangyari may mga close ko, may mga na-expose. Okay? Tapos, ite-test sila to find out if they were positive or negative. They rode to the testing center in the same car. And then, one of them was positive, 2 were negative. But we needed to quarantine na rin the 2 kasi nakasama niya yung isa sa sasakyan. So ngayon, we tend to test people separately. They don't ride the same car anymore. Yun.
Oh no.
Yun ang mga pagkakamali namin in the beginning. So, but you learn from experience eh. Pero ngayon, people ask me, no, Doktora, I was exposed. And talagang household contact ko po, like tatay ko. But I tested negative. Can I leave the house? My answer is no. Medyo controversial to, no? But whether or not you test positive, you need to quarantine for 14 days. Kasi masyado na pong the situation is so serious that we need to consider everyone really a close contact, and advice po ng mga infectious disease doctor, even if you test negative, you need to quarantine for 14 days. So actually, Reyna, may mga taong hindi na nagte-test kasi pareho lang.
Yes, agree ako, Doktora. And to add up dun to support your explanation, no. Totoo po na tama po si Doktora na wag na pong lumabas yung kahit negative po sa loob ng nakasama niya sa isang bahay is positive. Why? Possible na hindi, kasi tanong din yan, Doktora, sa page natin eh. Bakit naman ako nag-negative ako pero positive yung kasama ko sa bahay or one of our family member? Most probably, malakas po yung inyong immune system. Tama, Doc? And hindi kayo makapitan, hindi ma-penetrate ng virus yung katawan nyo. However, yung katawan nyo hindi ma-penetrate. Lumabas ka, positive yung kasama mo, negative ka, yung damit mo, naubuhan ng kasama mo or nahawakan or whatever, lumabas ka, pumunta ka sa mall, nag-grocery ka, humawak ka kung saan-saan, nagpagpag ka ng shirt, ayan na, nag-super spreader ka na. Di ba po?
And number two is, yes, that's correct. And number two is, we don't really know if you're negative eh. Kasi again, the test misses certain persons. So to be just 100% safe, you cannot leave the house. Period. Yun na yun. Talagang malungkot. But kasama ka na dun sa quarantine. Especially kung
Mm.
talagang close contact ka, lalong-lalo na po kung household contact po kayo. And people ask me, bakit ako hindi nahawa but I was in the same house? Ang tanong ko, baka naman ikaw doon lang sa kwarto mo. We don't know kung ano basically, we don't know kung ano nangyayari sa loob ng isang bahay. You get my point right now. Baka hindi mo kasundo pala yung kapatid mo, so never kayo nagkaharap. And na-gets, okay, we don't really know eh.
Gusto ko yung hindi
And then again, some people are just really more prone than others. Yun. Pero, the way the virus is working now, the entire household suddenly gets sick. Whereas before, one or two only. So tama po yun, mas tumindi ang paghahawa ng virus ngayon kesa sa dati.
Okay po. Next question po, Doktora. From one of our viewer last time, Miss Menchi Calvario Conanan Garcia. Good evening po, Doktora Ana. Ask ko lang po, if you are not aware that you have the virus but asymptomatic, how long will that virus stay in your body?
Ma'am, likely po, no, ang timeline po niyan is na-infect kayo day 1, day 5, ay, baka ikaw on day 5, usually yun yung symptoms. Kung talagang asymptomatic ka, pwedeng wala kang maramdaman. But sometimes, you don't even notice eh. Biglang, you're just suddenly clearing your throat. Biglang, you just feel like you want to sleep na. And then, hindi mo na-interpret na yun na pala yun. Okay? So, sometimes it's not really asymptomatic. It's not really zero symptoms eh. Kung minsan, mild lang talaga na akala mo you were just overworked, ganon. Sa job, yun na pala yun. So, how long will it last? So I'm assuming kung asymptomatic, de mild ka, no? Or even milder than mild pa. So usually, sinasabi nila, 10 days after exposure or 10 days after the first symptom, and then 3 days pag wala ng symptoms. Or in the Philippines, we put it as 14 days na lang. So I would say 14 days. Let's say your close contact got sick, you're an asymptomatic, 14 days po.
Okay, from one of our viewer, Miss Rosaliza Nepomuceno Ronquillo. Doktora, ang pagsusuob po ba at pagmumumog ng mainit-init na tubig na may asin, makakatulong po ba sa may COVID?
Kung gagaling po yung COVID nyo, it's not due to the yung suob. Ito yung steam inhalation po. At saka yung gargling. Pero on the other hand, wala naman kung na-harm naman talaga by steam inhalation. So, kung gusto yung gumawa nun, wala naman pong masama. Just know na it might make the symptoms feel better, but the virus nandun pa rin po. And again, mag-ingat po sa steam inhalation kasi usually when we inhale steam, that is usually how lumuluwag po yung plema ng tao. And it usually causes people to cough. And if you are COVID positive and you keep coughing, mas lalo pong nakakalat po yung virus sa loob po ng inyong bahay. But gargling, wala namang masama. Mag-ingat lang dun sa pagdura, no? Wag naman yung all over. But yun po yun. It might make you feel better, but the virus itself will not be affected po. And kung ubo kayo na ubo, baka kinakalat pa po ninyo. But again, that's a good question kasi marami pong nagtatanong talaga dyan.
From Mr. Christian Pagkunlangan, another question from our previous episode. Doc, ilan ang amplification count ng PCR test sa Pinas? Is it the same as other countries?
Ang alam ko, I do not know. I am not a microbiologist po eh. We should ask that sa mga lab techs. It's what we call the amplification eh. Kung mababa pa lang ho, nakuha nyo na yung COVID, that means marami talaga. If you need to keep amplifying it, in other words, tumatagal ng tatagal bago ka naging positive, that means konti lang talaga or dead remnants na lang. Can you flash the question again? Is it the same as other countries? What I could tell you naman, Christian, is the Philippines, yung standard po ng testing sa Pilipinas, international standard din po. So I would think that the answer would be yes. Yes, we are at par po with other countries. Di naman po tayo nahuhuli. Opo.
Okay. Next question po. From Miss Lisa Rina. After magstay sa quarantine facility, need pa po ba magpa-swab test uli to check if nag-negative ka na?
Yan ang napakagandang tanong which I keep encountering every single day. Okay, nakalagay po sa WHO, CDC, and DOH, after you have finished po the 14 days and that you had mild COVID. In other words, di ka na hospital, di ka na ICU, you just stayed at home or you just stayed in the quarantine facility. After 14 days, you are safe to go back to work and there is no need to repeat a swab test. Repeat, no need to repeat a swab test. Ngayon, the reason na maraming nagsa-swab test na pangalawa, dinidemand po ng kanilang trabaho. I would like to say this sa mga employers, mga corporate physicians. Please follow the DOH, WHO, and CDC guidelines. Actually, sa ibang bansa, Reyna, 10 days lang, pwede na. Sa UK nga, ginawa nilang 5 days. Basta 3 days, walang symptoms. Kasi if you're a nurse, they're so desperate na magkaroon ng nurse doon sa NHS nila. Na patratrabahuhin yung mga nurse kahit 5 araw lang. But imagine, UK yan. So the Philippines, 14 days. So talagang over na tayo sa international standard. So there's no need to repeat the swab test. And if your job is demanding it, nako, mag-usap na lang kami ni HR.
Doc, may dagdag ko lang dun sa mga nurses Yung mga nurses ko pong colleagues, nako, ang balita ko 6 days in a week na sila nag-duty. Tapos on call on a Sunday or on the rest day. Ganyan po katinding.
Oo, lalo na doon sa UK dahil sobra daw ang surge doon.
Yes, dito din sa
nabalitaan ko to from the father of a nurse. 5 days pa lang, halos, well, I don't want to use the term kinaladkad, but ni-require na silang pumasok.
Yes, dito din po, Doc, 6 days na po silang pinapapasok sa, especially the public hospitals po.
Nako, oh my gosh, kasi may surge. Pero pag positive ka naman dito, 14 days, wala pa namang 5 days. Sa UK, 5 days.
No, ang pagpasok na po ng mga nurses, 6 days na po.
I know that, 6 days. But if you become positive in the Philippines, you will have 14 days off.
Yes.
In the UK, when you become positive, you have only 5 days off.
Oh no.
Oh yes. Personal testimonial yan.
Oh my goodness. Okay,
next. Tatay na isang nurse.
From Miss Eileen Rubia of Ocfemia. Good evening po, Doc. This is kasi po the last from the last episode. Ano po ang nangyayari sa mga outpatient na naka-home quarantine po? Mayroon po bang representative from DOH na nagmo-monitor po sa kanila? Thank you po.
Ma'am, that's a good question. And sana meron. I suspect wala. So sobrang dami na po sa Metro Manila. Most of the people who just monitor are the barangay. And I think the barangay is also overwhelmed na rin po. So I would hope that the DOH could still follow up. I'm hoping and praying kasi malaking bagay pa rin ho yung follow-ups po sa bahay. And for the barangay, you really need to follow this up na kasi people could escape from the isolation and quarantine. Reyna, nangyayari yun.
Totoo yan, Doc. May mga nabalitaan ako I'm not sure, pero this is what's happening before magkaroon ng surge. Nag-positive, wala namang symptoms, asymptomatic naman. Hindi tinapos ang 14 days, doktora. Kasi ang katwiran nila, asymptomatic naman ako Wala naman di man ako umuubo, di naman ako nagsisisipon. Lumabas ng bahay, ito matindi, pumasok pa sa office. Doc, pumasok sa office, ayun. Malamang ito na yung isa sa mga story na ng mga
Yan ang rason kung bakit may surges, okay?
yes.
And I'm sorry to tell you, there are people escaping from quarantine. Um, Wala talagang ano eh, hindi naman natin mapulis lahat. I'm just really asking for everybody's cooperation. I suspect the DOH can no longer follow up talaga each and every case. But I'm hoping that the barangay still monitors po talaga. At kung kayo naman po, ito lang if you are going to escape from your quarantine, my question is, let's say, you will escape to the province, okay? Kasi syempre, magtatago ka, di ba? Ang tanong ko sa'yo, Reyna, welcome ka ba sa pagtataguan mo?
Baka nga tinago niya rin sa pagtataguan yan.
Yun na nga. So, ang tanong ko naman sa'yo, sa tingin mo, hindi mo mahahawaan yung tinaguan mo?
Ay, mahawaan. At
Lalabas,
saka
di mo malabas yun. Do you get my point, Reyna?
yes.
Okay, you're gonna escape. Okay, you're gonna escape. Where are you gonna go? If you're going to your relatives in the province, my tanong is, mahal mo ba sila? Why would you do that to them? Mabuti if you tell me you're gonna escape because you own your own house and you're gonna stay there. O, sige na. Okay? Actually, hindi escape yun eh. Sana sinabi mo na lang, may sarili akong bahay and I'm gonna quarantine there. Okay, good. Pero if you're just gonna escape to go to another place na may mga tao doon na mahal mo sa buhay at ilalagay mo yung positivity mo doon sa kanila without telling them, naku po, hindi mo sila mahal.
Napaka-selfish po nun, doktora. Napaka-selfish. I'm really sorry, but it's a selfish decision.
Oo. Ngayon, kung talagang if you're going to escape because you're gonna live by yourself sa bukid or sa kuweba so that you don't infect other persons, so be it. Kaya lang, if you're gonna tell them that you're positive, do you think you will be welcome? Okay? And then number 2, if you're gonna hide naman that you're positive, maawa ka naman sa mga tao dun. Yun lang. Yun.
Napakagandang
So,
point.
escaping, wala rin naman hong place that you can escape to na hindi ka po mang-aabala ng ibang tao.
Suspetsa ko dyan, doktora, hindi nagsabi. Pagka ganyan.
Ay, ang tanong ko, mahal ba nila yung pinagtuluyan nila or hindi?
Malamang.
Siguro the answer is hindi. What do you think?
Yes, hindi. Kasi kung mahal mo sila, hindi mo sila
Hindi mo
ahawa.
gagawin yun or sasabihin mo yun.
Agree.
And, okay, you escape there. Okay, you escape. Hindi mo sinabi. After 3 days, may nilalagnat na doon. Ano?
Diba? Oh no. O, tapos ang laki sa konsensya po niyan. Kaya andi dito po kami para pagsabihan po kayo.
Don't do that. Don't do that. Better stay na lang where you are. Magpagaling ka na lang. Tiisin mo na lang patapos na yung 14 days and then move on na po with your life.
Yes. Okay. Next, napakabigat doktora?
Maraming personal issues talaga dito. Pati
Yes.
magkakapatid, nag-aaway na ngayon due to differences of opinion.
True yan, doktora. Okay, from Mr. Henry Olokino. Hi po, doktora Ana. Safe po ba dumaan sa isang, let's say po, isang church na naka-lockdown po? Yung church is along mismo po, facing the kalsada. May gate naman po yung church. Thanks po, doktora Ana.
I would not go to any church ngayon. I would do a Zoom mass.
Okay, next po.
Yun lang po talaga ang best advice ko.
From Miss Yen Rutor, if neighbors are COVID positive, pwede bang silang lumabas sa bahay para magwalis sila sa harap? Even wala namang tao doon sa labas at nakamas naman po sila.
May kasama ba sila sa bahay na hindi positive? Kasi, if you are the positive person and there are 5 persons in your house, And then yung 5 na yon, we don't know if they're positive or negative. Quinarantine na lang po natin sila. You, as the positive person, have to remain in your room. You need to lock the door. Okay? You need to lock the door. Okay? You have to stay there in the room. You have to open the bintana para may circulation din ng hangin. Okay? You cannot leave that room for 14 days dahil may 5 kang kasama sa bahay na hindi po natin alam kung positive or negative sila. So you cannot go out. Okay. Now, if the 6 people in the house are positive, I would suggest, wag na rin ho kayong pumunta sa yard, maawa na lang kayo sa kapitbahay. Unless you live in a farm. Kasi, kung ikaw naman yung kapitbahay ng mga positive, Rina, would you like to see them outside? I don't know. Siyempre, naawa din ako dun sa mga tao. But I have also, I don't know, ang advice ko na lang po, if you are only one person and there are other people with you who are not positive, stay in your room and lock the door. Ngayon, kung let's say, 6 kayo sa isang bahay, all the 6 are positive, and they want to leave the house to walk around the yard, ewan ko, parang ayoko rin ho yun kung ako yung kapitbahay eh. Though theoretically naman, I don't even want to go into gaano kalayo yung mga bahay nyo sa isa't isa, may fence ba or what. Siguro parang ano na lang din ho sa mga kapitbahay, just stay inside your house. Okay? Ikaw,
Eh,
Reyna, what do you think?
paano yung mga bahay sa mga barangay? Mga tabi-tabi.
Kaya nga, if you are positive,
Diba?
stay inside the house. Opo,
Okay.
stay inside the house.
For me
Sa
naman,
akin,
yes, agree ako sa'yo, doktora. Wala namang mawawala kung magstay ka na lang sa loob ng bahay. Baka pag lumabas ka pa, may mawalang tao. Yun po yun, di ba, doktor?
stay inside the house na lang po is my best
Yes,
advice to you.
agree,
Stay
agree.
inside the house. Opo, ay, out of respect na lang po sa kapitbahay nyo. Kasi isipin nyo naman rin po yung pakiramdam ng kapitbahay.
Ngayon, doktora, if yung concern niya is siya naman negative, tas magwawalis pa daw ba siya sa, sa may tapat ng bahay, sa may tapat ng
Wag
bahay,
na. Stay in your house. Kasi pagmumula na lang yan ng away, Reyna.
yes, kasi baka mamaya mag-positive pa kayo, yun pa po ang mangyari. Mag-away lang.
Hindi, I mean, there are many aspects to quarantine, one of which includes the feelings of your neighbor.
Yes po, okay. Napakabigat.
Ang bigat, ano?
Yes. But these things, doktora, hindi po
Very
kami,
practical.
yes, dinidiscuss po namin ito kasi madami pong, kaya po tayo
Ang dami
nagkaroon
nagtatanong, may nag-aaway pa.
yes,
Ay,
plus,
yung pinsan ko, reported na kapitbahay. Eto, gusto mo? This happened in Forbes Park. Okay?
sige po.
The kapitbahay son was positive and quarantining in their house. Ngayon, the kapitbahay claims to be negative. And nag-walk-walk sa village. Even though, as close contacts, they're not supposed to leave the house. So ngayon, hinihingi po nung association yung kanilang negative result. Ayaw naman nilang ipakita. Okay, ganito. If you are the close contact, you are not allowed to leave the house. Period. And even if you have a negative test, you cannot still leave the house for 14 days. Yun na po yun bago. If you don't know that, yun na po yun. Okay? All right.
Okay, next po, doktora. From Miss May Guarin, Ellie, doktora, what to do po if someone is experiencing cough, fever, and muscle pain, pero ang smell and taste ay di nawawala? Is he considered a COVID positive? Salamat po.
Kung na-expose, parang natanong na ito yesterday, but anyway, kung na-expose po ito sa COVID, at talagang may matinding possibility, I would get a swab. I would get a swab kasi lalo na kung na-expose, mataas po yung possibility. But of
Okay.
course, I would get a swab kung talagang na-expose. Kung
Yes.
hindi naman na-expose at sa tingin niyo talagang flu talaga, then lock yourself in your room na rin and don't go out until you know for sure.
Yes. Okay. Doktora, from Mr. Pasha Jose Arnel. Good afternoon, Congresswoman Doktora Ana York Bondoc, at maraming salamat sa paggagabay ninyo sa amin. God bless.
Ay, talagang it's very difficult time po. Kaya please take this opportunity to to ask question. Kasi po ako mismo, I could not even call my fellow pulmo. Hindi na ho sila makasagot ng telepono sa sobrang busy.
Okay, from Miss Elizabeth de la Paz. Doc, please, try Linghua capsule, Chinese made from Mercury Watson. Mura lang po for mild cases, as tried by Mayor of Mandaluyong, Ben-Hur Abalos, and family who are inflicted by COVID. So, tinatanong niya, Doktora, if this is effective daw po ba?
Na-license po siya ng FDA eh. So, again, there's not much information po. At saka Chinese siya eh, kaya hindi ko po nabasa. But it was given a permit by the FDA.
From Miss Lucita Pabalan, thank you, Doktora, for that info.
Thanks, Ma'am Lucita.
From Mr. Eusebio Bondoc, mask, face shield, distancing.
Nako, sir. Go na go.
From Miss Lucita Pabalan, keep safe and your family.
Salamat po.
From Miss Reg Frejas, Doktora, ano yung Linghua from China?
Ito po, this is a Chinese traditional medicine that was recently licensed po by the FDA or given a permit. Some people po have tried it.
From Miss Adoracion Malyari Balingit, good afternoon po.
Hi,
From,
ma'am.
from Miss Doris Esguera Kunanan, ano po ang pagkakaiba ng asymptomatic sa COVID positive?
Ayan, maganda yan. When you take the PCR test or the swab test or yung yung sa ilong po, no? You will be given a result either positive or negative. What is the meaning of positive? Good result ba yon? Hindi po. Ang positive means may nahanap po silang COVID sa dugo nila. Okay? Negative means no COVID was seen. Okay? Ngayon, what is the meaning po? So, yon, alam na natin yung positive and negative. So, yung positive, may COVID na nakita. Yung negative, walang COVID na nakita. So, positive means may COVID kayo. Okay? What is the meaning of symptomatic at asymptomatic? Yung, can you type it, symptomatic? Okay, ayan. I-ano ko po lang po. Let me type it for Miss Rina. Ayan po.
There you go po, Doktora.
Ayan, very good. Thank you. What is the meaning po of symptomatic? Meaning po sa Tagalog is may simptomas na nararamdaman. Or may nararamdaman po. What could this be? Panghihina, fever, inuubo, muscle pain, matindi pong pagkapagod, hindi na po makabangon. Yung iba po nagtatae. And then some people lose the sense of smell and taste. Yun po yung mga sintomas. Okay? Pag naramdaman nyo po yon, may sintomas kayo or kayo po ay symptomatic. Okay? Ano naman po yung asymptomatic? Please put an A in front of the word, Reina. Asymptomatic means walang nararamdaman na sintomas. Ang meaning nun, okay na okay kayo, wala kayong nararamdaman, wala kayong lagnat, ayan, asymptomatic. Wala kayong lagnat, wala kayong ubo, wala kayong pagod, wala kayong panghihina, wala kayong muscle pain, hindi kayo nagtatae. In other words, you feel perfectly okay. So, anong percentage ng tao yung asymptomatic? Very small percent lang po talaga. Not naman all. Marami hong makakaramdam eh. I would say around 20%. Ang theory ko, it's not really asymptomatic. Baka ho mild lang. And then akala nyo po, napagod lang kayo, Kung nakipag-inuman kayo, baka feeling nyo masyado na kayong maraming ininom. If you're a student or an office worker, maybe too much work. Kung kayo po ay nabasa sa ulan, maybe dahil napasmado. But actually, yun na po yung mild COVID. And then there's also a difference between pre-symptomatic and asymptomatic. Ang meaning po ng pre-symptomatic, kasi po day 0 kayo na-expose, ano po. Lalabas po yung sintomas nyo day 5. So, between day 1 to day 5, akala nyo asymptomatic kayo. Wala kayo na, I feel well, wala akong nararamdaman. Tapos biglang day 5, ayan na yung lagnat. So, ang meaning nun, from day 1 to day 4, or day 5, kayo po ay pre-symptomatic bago pa po dumating ang mga simptomas. Pagdating po ng day 5, pak, lagnat. Oh, may simptomas na kayo. Okay? So, a lot of it depends on the timing of the exposure po.
From Miss Kathy Rodriguez, I am waiting for any type of vaccine, doc. My sister and my brother-in-law got their second dose of Pfizer vaccine.
That's good to hear, ma'am, and congratulations. I'm also happy to hear po na kayo po ay willing to be vaccinated. Siguro maybe the better question is, ba't wala pang bakuna? Mabagal ba ang Pilipinas? Well, I would like to tell everyone this. There is a global shortage. Reina, please type global shortage of vaccines. Okay? I will forward that. So, eto po. There is a global vaccine shortage. Ayan. Ayan. Okay, global shortage of vaccines. Anong meaning nito? Ang meaning nito po we have to, this is a worldwide problem. Pandemic nga po, okay? All over the world. So yung mga countries po, they would like to vaccinate all their citizens hanggat maaari. Ano po? So syempre, like America, like the United Kingdom, like Italy, like China, like mga big countries na may mga first world, they are all yung iba producing their own vaccines, yung iba naman po buying all the vaccines that they possibly can. So, meron po tayong tinatawag na global shortage of bakuna. Or kahit may pera ka, wala kang mabili. That's because binili po lahat ng Amerika. So, yung mga galit ho kay President Duterte, huwag kayo magalit kay President Duterte. Magalit po kayo kay President Trump at kay President Biden dahil sila po yung ayoko sabihin sakim pero sila po yung desperado. Okay, they're also desperate to vaccinate their own citizens. But I would like to tell you this, no? And sinabi na po ito ng UN kanina lang. They are urging the countries to donate their vaccines na hindi po nila kailangan. And because if there's anything po na nalaman natin sa COVID na to, you will not be okay unless everyone is okay. Kumbaga, this is a global problem. Hindi lang po pwedeng ako lang. It has to be tayong lahat. So, thanks Miss Cathy for your willingness. And ito malapit na ho malapit na ho matapos ang US sa bakuna nila. The moment they finish, it will free up the supplies for the rest of the world.
From Miss Gemma Abaricio sa Turay, Doktora, tanong ko lang po, nasa ospital pa ang positive na swab na siya uli para malaman kung okay na at pwede na siya lumabas pag negative na. Di na ba siya nakakahawa pag lumabas siya?
Ma'am, actually nga, as I mentioned, no, those with mild COVID do not need a second swab. Those po na naging moderate to severe na hospital po or mas grabe po yung nangyari sa kanila, their doctor might decide to have a second swab. So pag nag-negative na po talaga yon, hindi na po sila nakakahawa. Promise. They are not nakakahawa po. Maraming natatakot dyan yung paglabas ng mga relatives from the hospital, Reina.
Yes, and din, siguro, para to be sure, isolate nyo muna po, di ba, no, Doc?
Hindi naman. Pag pinalabas na talaga, that means they're okay.
Okay, na-clear na po. Okay.
Na-cleared na.
Okay, and then next po from Miss Aloha Big Bear Hug. Kapag po ba asymptomatic ka, pwede po mag-self-medication na lang. Isolate na lang po sarili tapos po uminom ng vitamins. Thanks po, Doc.
That is okay to do. Kasi ang meaning nun is mild. But you forgot to say this, Ma'am Aloha. You need to inform the barangay, you need to inform your job, you need to inform your family kasi po, they need to do contact tracing. Hindi naman ho lahat ng tao kailangan pumunta ng ospital. It is okay to isolate, but you need to inform. And again, just because you're asymptomatic doesn't mean nalilibot-libot ka sa bahay mo. Lalo na kung may kasama ka. Kasi despite your being asymptomatic, nakakahawa ka pa rin. Maraming nangyaring ganyan, Reyna, ha? Wala akong nararamdaman. Siguro negative yung COVID test ko. Nagkamali lang. So I'm gonna wander around my house, ganon, and make kwentuhan with my sister, my brother, my mom. I'll just stay at home, but I will not stay in the room. Next thing you know, nilalagnat na yung nanay mo, nilalagnat na yung kapatid mo, at hinihingal na yung lolo mo. And all because of you.
Doc, mukhang ganyan ang nangyari nitong kung bakit nagka-surge.
Marami. They don't want to believe.
Yes, maraming nagpetics. Wala po, hindi po kami nagsisisihan, pero magsisisihan na po tayo ngayon. Madaming nagpetics. Madami talaga, Doc. Madami din nagsabi na, ay naku, tingnan mo yung COVID, parang trangkaso lang. Kawawa naman yung mga namatay dun sa statement nung, di ba? Parang trangkaso lang.
I mean, baka ikaw, you're young, so you're asymptomatic. But remember, baka yung mga kasama mo sa bahay, si lolo mo dinadialysis. O, libot-libot ka sa bahay mo. O, na-positive tuloy si lolo sa'yo. Ngayon, nasa ICU si lolo. Paano yun?
I cannot imagine yung mga napuntahan niyang lugar na asymptomatic or nagsipagtigas lang ng ulo, nag-bar, kumain sa labas.
Hindi, yung iba talaga ha, ito lang ha, Reyna. Pag na-positive, medyo they will stay at home. Pero they don't respect their bedroom. Lalabas sila. Again, if you love your parents, if you love your lolo, if you love your brothers and sisters, do not go out of the bedroom for 14 days. Talaga.
Okay, another question from Miss Vilma Maniego. May maitutulong po ba ang pag-inom ng vitamin C para panlaban sa COVID?
Wala naman pong ikakasama. That's what I would say. If you want to drink vitamin C, it's okay. Pero yung mga mega doses, like lumaklak ng vitamin C, doon mali na po yun. If you want to drink 1 vitamin C a day, nothing wrong with that. Opo.
Doc, from DM Sebastian. Doktora, tanong, bakit po yung ibang nagka-COVID-19 is umaabot ng 4 months palaging positive results sa swab test?
Ay ma'am, that's a difficult question. Yun po yung tinatawag po nating remnants. It is possible po to have a positive swab test months after you have COVID. But usually po, no, they are the dead COVID in your system. But there have been a very, very few cases. Last time I heard it was around na nagkakaroon po ng pangalawang infection. Halimbawa po, kayo po ay nilagnat uli 6 months after your COVID, na nawalan kayo uli ng panlasa. I would treat it as or go to the doctor again. Problem po talaga yung positive swab test. Almost sure those are remnants. Reinfection very rare. Pero, nabalita po that the Brazil variant can reinfect those who were sick before. So, problema po yan. And that's the problem of the variants.
Actually, Doc, di ba kahit nagka-COVID ka, pwede ka ulit magka-COVID? Tama po ba ako?
Hindi, very rare. That's what I say. Very rare.
Rare.
Very rare. It can happen. I don't want to say no. May 40 reports all over the world there. Very rare. Pero sa Brazil daw, marami daw na nagkasakit dati na nagkasakit uli. So that's really scary.
Baka yun yung
the Brazil variant is really very strong.
Oh no. Oh no talaga.
Oh no talaga.
Okay, from Miss Maricar Ladimo. Bakit, Doc, until now wala pa din nahanap na gamot dyan para sa COVID? Actually, last year pa po yan. Dapat sa haba ng nakalipas na buwan at araw, dapat pinag-isipan na po kung anong gamot ang narapat sa may COVID. Napakagandang po tanong, Doktora.
Yeah, that's a good question. Let me put it this way, Mom. I've been a doctor for a really long time. There are a lot of antibiotics. There are very few antiviral. Konti lang talaga. Even dengue, walang gamot eh. Oh, how long na ba ang dengue? So there are 3 medicines that have been found to work for severe COVID. Ito po ang dexamethasone, remdesivir, and tocilizumab. So those are the 3 gamots. They are expensive. The dexamethasone is very cheap. These are the ones that have been found to be useful for severe COVID. For mild COVID po, meron sinasabing immune boosters, so you can drink vitamin C, you can drink zinc, you can drink vitamin D. Wala naman pong nothing bad. Why is there no medicine for COVID yet? Ma'am, may limits din po ang ang science. And again, I'd like to pose the question, why is there no medicine for dengue?
Oh, no. Medyo
Yeah, I mean, what? Oh.
Napakagandang sagot sa napakagandang tanong. Tama po
Oo,
ba?
maganda. These are valid questions. Ma'am, eto lang eto pa. Don't lose hope. Marami pa rin ho mga ibang gamots that are being tested sa mga clinical trials po to find out if they are going to work versus mild to moderate COVID. We have 3 gamots that work against severe COVID. Ayun po.
Yes, Doc. Okay. Tama po.
Prayers siguro para makahanap din tayong gamot. I'm personally praying.
Okay, next po. From Mr. Mel Aquino, big help po.
Thanks, Sir Mel.
Okay, parang, okay, sorry. From Miss Maricarla Dimo, Doc, yung sinasabi po ba sa Fabunan vaccine, totoo po ba na nakakagamot sa COVID yon?
Ma'am, personally, I don't know about the Fabunan vaccine. But kung meron po, my best suggestion is isubmit po for emergency use authorization po sa FDA. And meron po tayong panel of experts. Meron po silang mga vaccinologists, virologists, immunologists, infectious disease. Isubmit lang po, titingnan po ng Pilipinas kung maganda po yung datos at kung maganda, bakit hindi po i-license? I have nothing against any gamots. I just want them to pass po the proper process kasi baka may maharm po tayo by giving them on our own.
Yes. And this is ingested.
Apply lang po sa FDA.
Okay po.
Submit the data, have a clinical trial, apply, and then let's see po kung ma-approve. Kung ma-approve, go.
Shout out po kay Mr. Eusebio Bondoc, nanonood po siya. Nag-comment po siya, yes po, maximum 10 days lang po.
Po, yan. Yan ang UK. Nasa UK si Mr. Eusebio. Eh, mas maingat pa nga tayo sa Pilipinas, 14 days dito eh. Which I like.
Okay, next question. From Miss Ednalyn Aquilon Rojo, Doktora, ask ko lang po, papaano po maiibabalik yung walang pang-amoy? Salamat po. Maganda po yung question niya, Dok.
Ay, that's a beautiful question. And also very difficult. Ito lang kasi sino to? Si Ednalyn. There have been many articles about this. And this is what we call long COVID or the long-term effects of the virus. Kasi tayo, and of course, I know naman the Philippines, we're so panicked. Kasi, di na natin maisip yung long term eh. We're just trying to, na lang yung declog the emergency room, sana walang mamatay. Alam mo yon, yung immediate, what's happening now is what we're trying to fix na lang. Kasi, di na talaga, we don't have the resources to be moving farther away. Pero eto lang po sa mga tao na hindi naman na mahilig magsabi na hindi naman sila namamatay ng COVID, there are long-term effects na ngayon pa lang po lumalabas. One of this is paano makabalik yung pang-amoy at kasama na po yung panlasa. Alam mo, Reyna, sometimes we never think about our sense of smell kasi napaka-automatic niya, di ba? We think, ayokong mabulag, ayokong mabingi, mahirap yun eh. Ayokong mapipi, like for example, so stroke, unable to talk properly. Maraming ganun eh. But I never heard anyone say, ayokong mawala yung panlasa ko tsaka pang-amoy. No, di ba? Parang, oh, but it can be very devastating, and it can affect the way you eat. Kasi if you cannot smell anything, related siya sa tasting eh. So if you cannot taste anything, yung gana mo talaga, it's gone. Okay? And then, eto lang Reina ha, eto lang, and to everyone, if you cannot taste what you're eating, consequent to smelling na po yun, nakasama na yun, yung enjoyment mo sa food, nako, talagang bababa. Para kang you're chewing cardboard. And think of it this way. If you are a person who enjoys food, you enjoy entertaining, hindi ka naman mataba, but it's fun to eat, 'di ba? It's a way for you to get together with your family, you're a good cook, ganon. Imagine if you're eating cardboard biglaan. Maraming nade-depress. I would like to tell you this, hindi na papag-usapan, but not being, imagine eating cardboard for the next 365 days of your life. It can be very depressing. So, aside from, there are long-term, may mga tao po na may long-term loss of sense of smell and taste, they become anorexic, they don't like to eat. Some of them become depressed with their life. How to get it back? Merong iba po na nag-training ng they smell coffee, they smell oranges, they really try to tinitingnan po nila yung picture ng kape, tapos inaamoy nila. Parang may they try to train their brain na ito yung amoy ng kape. And then aamuyin po nila yung orange, titingnan nila yung picture. This is somewhat similar to how we reconnect with stroke patients. It's both here and in the sense organs. So so ganun po, there's what we call sense training and scent training. So yun po, you have to work with an occupational therapist and I don't know kung physical but what I know is occupational therapist. But it's
Yes.
a difficult problem that people do not talk about. Kasi thank the Lord I'm alive, mga ganon. Later on, after 3 months, cardboard pa rin ang kinakain ko. Paano na to?
Yes,
Hindi po
Doc.
nakakatawa yun.
Yes po. Opo. May dagdag ko lang din, Doc, no, yung actually there are trainings in not because I'm into essential oils pero there are trainings in aromatherapy na ginagawa din
Oo,
po.
ganon.
Opo, para ma-familiarize
Pwede,
yung
pwede. Para ma-familiarize yung sarili mo.
yes, and yung scent para maibalik po. Okay.
One tack, Miss Rain.
From Miss Jack Santos Tupas, Dr. Ana, is it better to undergo PCR test before acquiring the vaccine?
No, ma'am. Just go straight to the vaccine na po. Kung wala naman po kayong COVID. At hindi kayo
Ayan,
nagka-COVID.
mali ng sagot nyo, doktora. Napakalinaw po, Pwede na pong dumiretso.
Ako, I didn't have a PCR test. I had a vaccination.
From Miss Janet Articona Brosas, a blessed afternoon, Dr. Ana.
Hi, ma'am.
From Miss Remy Reyes, good day po, Dr. Watching here in QC. From Miss Leia Peña, beautiful and good afternoon, Dr. How nice the topic.
Ma'am, practical talaga tayo ngayon kasi hindi na matawagan ng mga doktor eh.
At hindi na rin makausap ng maayos ng mga tao.
Wala na. I was trying to call my resident na dati ko residente. Hanggang text na lang, pinadala ko na regalo.
Totoo, Doc. From Miss Cathy Rodriguez, do COVID antibodies protect against new variants?
Napakagandang tanong. everyone is hoping that the answer is yes, but we don't actually know yet. So, as I told you, ma'am, may case report po sa Brazil na yung mga dating may antibody na-infect pa rin ho ng variant, Brazil variant. So, ganun ho katindi si Brazil variant. But again, ma'am, aside from antibodies, there are two kinds of cells that also will protect you. These are what we call the memory cells, which are T cells and B cells. They work differently from ibang ano po sila sa antibody, no? But they're also in your blood. They will also recognize, parang memory, nakita ko na to, kalaban to, atakihin po nila yung bagong pumasok po na variant. So, we still do not know the answer to this question, but ano po, hindi pa po natin alam. In Brazil, the answer is people who've gotten COVID before and presumably have antibodies, nagkasakit pa rin ho. Yun.
Okay.
Ito pa. Wait. Ma'am Cathy, ito pa. Presumably, kasi we're not really, pinag-aaralan pa rin ho. After 6 months, nagwe-wane po yung antibody protection of natural immunity. Halimbawa po, you got COVID 6 months ago, after 6 months, pababa na po yung immunity nyo. That's why people who have had COVID before are advised to get the vaccine. And may nabasa po ako na people who've had COVID and got the vaccine, mas maganda pa rin, ang ganda daw ng kanilang antibody response compared to those who never got COVID but nabakunahan.
Okay. At least malinaw po. From Miss Eugenia Nebrida. Hello po, Doktora. Maganda po yung topic. God bless po.
Thanks, ma'am.
From Miss Flor Parinas. Good PM po. Doktora, if nag-second swab na po ang patient at negative result na siya, mga ilan pa pong siya dapat mag-quarantine? Hindi na po siya maaring makakahawa. Thank you po. Stay safe.
Pakiulit lang. Sorry, dumaan lang po si Benji.
Apo. Good PM po, Doktora. If nag-second swab na po ang patient at negative result na siya, mga ilan pa pong days siya dapat mag-quarantine? Hindi na po ba siya nakakahawa? Thank you po. Stay safe.
I'm assuming, ma'am, that the patient had the negative swab at wala na po siyang nararamdaman na matagal na. That person is no longer nakakahawa. Pwede na pong lumabas.
From Miss Remy Reyes, Doktora, is it possible ma-transmit through food virus? Ay, napakaganda ng tanong po.
It's possible, but not common. Wala pa rin hong case report na group of people nagka-COVID from a lechon or group of people po nagka-COVID from fried rice. Unlike, for example, E. coli mass food poisoning, wala pong ganun eh. So I would say po, it's primarily a respiratory virus. But if you order food, painit nyo na lang uli.
From Miss Jess okay, they're tagging po their love. Salamat po. From Miss Fer Clarin, Doktora, may kapitbahay po kami, lahat ng symptoms po ng COVID nasa kanya na. Pero ayaw po niya magpa-swab test. Nandito lang po sa bahay nila. Ano po dapat namin gawin para hindi po kami mahawa?
Huwag kayong lumabas ng bahay nyo. Wait. Is this kapitbahay wandering around her house? Or just staying lang naman there at parang ayaw lang, baka naman wala lang perang magpa-swab yung tao. Pero in-isolate naman niya yung sarili niya at quinarantine. If that is the case, it's actually okay not to be swabbed. Basta you follow the protocol. Sabihin nyo na po sa barangay na nasa inyo na po lahat ng sintomas ng COVID. Wala kayong perang pa-swab. So either the barangay will decide whether you should be swabbed and somebody else has to pay for it, or you just stay na lang in your house for 14 days. And your entire, or pumunta kayo, kasi you will not be accepted to a government facility without a swab eh. So you could just stay na lang po in your house for 14 days at huwag kayong lalabas doon. Pwede na rin yun. Okay? Kaya lang, if iba yun eh, yung no money to be swabbed. Iba yung in denial and running around the barangay. Mali yun. Pag running around the barangay at alam mong lahat, you have to tell the barangay captain po. Kung ayaw niyo naman maging sumbongera, just don't hide in your house na lang po because this person and her family are irresponsible. Ayan. Paki-flash lang po the title, not global shortage of vaccine. Yeah.
Sorry for that, Doktora.
No problem. Busy rin tayo answering and flashing all the
Apo.
questions kasi.
Okay. From Miss Remedios Nogoy Jeronimo. Good afternoon po. Ingat po tayo lahat. Watching from Vizal, San Pablo, Candaba, Pampanga.
Ma'am, talaga, truly. Ito lang nga, ma'am, question to everyone. Mag-Holy Week na po. Should you encourage your relatives from Metro Manila to go home to the province to celebrate Holy Week?
Naku, yun na, patahimik. Kumbaga, hayaan nyo na pong manahimik yung mga relatives nyo po.
Me, my answer is no. I would not invite them. And number two, if they come, I don't like to see them. Sorry talaga.
Yes. Huwag na po natin silang idamay sa mga kakulitan po natin. Pasensya na po kayo, pero
Naku,
talaga.
really.
Okay.
Ito, Reina, answer this question.
Sige po.
May panata po kami na magprosesyon every Holy Week. Dapat galing po kami ng Novaliches or Taguig. We want to make procession in our hometown. Dapat ho ba kaming umuwi? Reina.
Pakiusap lang, di ka na nga natin. Pasensya na, ito ang sagot ko talaga. Matahimik ka na lang sa bahay, nagprosesyon ka pa. Naglakad ka pa. Kung wala ka pa, yes, no, no, no.
So, yun lang po.
Okay. Okay, from Miss Karina Oh, Doktora, shoutout lang po sa 210 collated viewers po natin from YouTube.
Thank you po.
Opo. I-share nyo po para madami pong mga ma-enlighten sa topic po natin. From Miss Karina Rumbawa, Lincuna, Doc, after 10 days of quarantine tapos wala pa pong sintomas, di na po siya nakakahawa. Doc, pwede na po makimingle? Ay, Doc, pakisagot nga po ito.
Ma'am Karina, after 10 days, it's either after 10 days, after the first symptom, or 3 days po na wala ng simptomas. So, ito nga, 10 days si ma'am. You can actually go out of your house po already. Yung mga kasama nyo sa bahay, you can talk to them. Di na po talaga kayo nakakahawa. Whether you should mingle is another issue. Okay? I would say take it easy lang muna kasi syempre nagkasakit din po kayo eh. Pero I mean, truly, hindi na po kayo nakakahawa.
From Miss Chinky Uy, hi Doc, when is the best time to get tested when exposed to a COVID positive? Should they get tested agad-agad once they knew na they were close contact by a COVID positive patient? Maganda po.
Ma'am, that's a question and an issue that happens every time po, no? Kasi yung first natin, halimbawa, may pumutok na yung co-worker nyo na positive, immediately the next day lahat ng tao nagpapaswab test. Okay? The most important thing to do po is not panic muna. Know the details po nung nag-positive. For example, I'm just starting from office, okay? Halimbawa, yung sales rep nyo nag-positive, tumawag. Nung January pa po siya, kasi Visayas sales rep, never went to the Manila office. So, dapat bang magpa-test yung Manila office? Ikaw, Reyna. Nasa Visayas yung mama, and has not been in Metro Manila since January.
Na-expose na po? Siguro, Doc?
Hasn't been to the office since January. Ngayon, you heard na he became positive. Today is March. So, hindi. Kasi hindi kayo the person hasn't been in the office since January. Just because that his address is the office. Na-gets niyo yun? You have to determine what day you were exposed to this person. Okay? Kasi kung minsan, nagpapanik talaga yung mga tao, oh my God, the messenger got positive. Kasi tatawag na lang sila eh, may na-positive po si messenger. Then everyone's like hysterical. But sandali lang, when is the last day that the person went to the office? Kung 2 weeks ago naman po, hindi na kayo kasi 2 weeks kayo nagkita. So, it has to be a recent close contact. Hindi po yung isang buwan kayo nagkita, okay? Kasi the lifespan of the COVID is 9 days or 10 days. Sabihin natin 14 days. If you have not seen this person in 14 days, more or less, okay na kayo. Okay? Like for example, January pa kayo nagkita, March ngayon, no need to rush. But, if you, let's say, saw each other yesterday or a few days ago, then you have to count 5 days po from the time of exposure to that person. And that is the best time to be tested. Kasi day 0 is the day na nagkita kayo ng positive, okay? Day 1 is the day after. So from day 1 to day 3, ma'am, mababa lang po yung yield. So kahit magpa-test po kayo, it will likely be negative. Day 5 to 9 to 11 to 12, malaki po yung possibility na kayo po ay mag-positive kung talagang positive po kayo. So, if you have been exposed to someone, count 5 days from the day of exposure and that's the time that you should have a swab test. Pero, if you have been exposed to a truly positive person the next day or the moment you hear this news, you are already needing to quarantine. Huwag niyo pong hintayin yung resulta ng swab test. Kung sinabi po sa inyo, your coworker in the same room who you ate lunch with was tested to be positive, agad-agad quarantine yourself, and then 5 days after you met this person, then have yourself tested. Ngayon, kung araw-araw kayo nagkikita, then you can have yourself tested already. I hope you got that. Ma'am Chinky, kung may kulang pa, just follow up, okay, with another question. Kung may kulang pa po.
Maganda yung
But 5 days after exposure. Pero the quarantine has to start immediately upon knowing na na-expose ka.
Napakaganda po ng explanation, Doc, kasi you have, yung nabanggit niyo yung 5 days to count backwards. Kung 5 days, count backwards na kung expose ka ba doon. Napakaganda po nun. Madami pong hindi nakakaalam nun. So, yun po.
5 days.
Opo. From Miss Ben Caronan, Doc,
Wait. Balikan natin yung question ni Ma'am Chinky. Okay, na-expose ka. Wala kang perang pang swab. Anong dapat mong gawin? What to do? Quarantine pa rin. And then, hintayin nyo na lang po. If you get symptoms, kung wala kayong maramdaman for 14 days, just stay in the house for 14 days. Okay? Kung kayo po ay nilagnat, you start to feel worse, then it's advised that you get a swab test.
Napakalinaw. Ayan po Okay. From Ms. Ben Caronan, Doc, very informative. Lalo na po yung close contact of the same household. Adherence to isolation and quarantine is strictly observed, even with no symptoms at all.
True.
From Mr. Remedios, no.
Please don't be pasaway kasi pasaway issue yan.
From Ms. Remedios Nogoy Jeronimo, sana nga may bakuna na. From
Praying.
From Ms. Flor Parinas, Doktora, bakit po wala naman symptoms nararamdaman pero nung sinwab test positive ang result? May bahagya pong ubo ng swab ang patient pero okay naman ang pakiramdam niya kaso nang lumabas ang swab positive pero until now naka 9 days still no symptoms na nararamdaman pero naka-isolate naman po siya sa kasalukuyan. Thanks po sa advice.
Let's just thank the Lord na mild po yung kanya. But again, whether mild, moderate, or severe, nakakahawa po yun. So, tama po yung ginagawa ng tao. And, napansin mo yung can we go back to the question? Sige, basahin nyo.
Doktora, bakit po wala namang symptoms na nararamdaman pero nung sinwab test, positive ang result? May bahagya pong pag-ubo ng swab ang patient pero okay naman ang pakiramdam niya. Kaso nang lumabas ang swab positive pero until now naka 9 days, still no symptoms na nararamdaman. Pero naka-isolate naman po siya sa kasulukuyan. Thanks po sa advice.
Parang may nabasa ako na bahagyapong ubo. Yun na
Yeah.
po yung sintomas niya. You told me, wala siyang nararamdaman. Meron. Yung ubo. So what I'm trying to say is, rare talaga yung zero-zero. Akala, di ba, from the question, they started muna walang nararamdaman. After that, may bahagyang ubo. Meron po. But it was mild. And thank God for that. Opo. Again, I would like to congratulate that patient. Despite the mild symptoms, talagang masunurin po siya sa kanyang isolation and quarantine. Congratulations po doon. You are a good example po sa mga positive. You love and care for your family at may care and concern din po kayo sa buong Pilipinas. Thank you for sharing that.
Okay po.
O, di ba, Rina? Kahit mild siya, sumusunod.
Yes po. From Miss Kathy Rodriguez, can you spread COVID after recovery?
Majority po talaga ng nagiging spread, Ma'am Cathy, we're not from people who recovered. Majority of the spread talaga were from people po who were exposed, who got COVID, and walang naramdaman, and umiikot, and then on day 5, pa, lagnat at ubo. Tapos pag linista mo, ano kung ginawa nyo from day 0 to day 5, may hilo ka sa dami. Yun po
Hi,
yun.
Doc. Nakakaano. Okay, from Miss Jen Pabuayan Velasco Tagayon. Hi Doc, good afternoon. Safe po ba para sa nagpapa-breastfeed ang vaccine for COVID? Tanong ko din to, Doc. This is also my question.
Yes. Actually, the answer is yes. In the US po, breastfeeding moms have been vaccinated. But again, I would advise you to talk to your pediatrician po muna.
At least I know na pwede.
Pa-clear ka na lang po muna sa pedia.
Yes po. From Miss Gemma Abaricio Saturay. Thank you po, Doktora, sa sagot.
Thanks, Ma'am Gemma, sa tanong.
From Miss Marjorie Simbulan Malyari. Good day po, Doktora. Ano pong pagkakaiba ng flu sa COVID?
Ma'am, they are different viruses, okay? First of all, they are different viruses. Coronavirus po yung isa po is a different talagang iba. Okay, so they're different diseases. I think you're trying to ask me na lang yung baka yung clinical presentation. Actually, what is the meaning of clinical presentation? Ano yung symptoms? Unfortunately, Ma'am Marjorie, talagang if you ask mga doktor, merong mga nakatala dun na how to tell flu from COVID, ganyan. Pero the truth of the matter is, clinically, it's hard. Clinically, it's hard. And sa mga panahon ngayon, of course, we don't want to make the mistake na, ay, flu lang yun, umuwi ka na, okay lang yan. Sige, umikot-ikot ka sa barangay mo. Then, next thing you know, COVID na pala. So, ang rule of thumb talaga ngayon, ma'am, kung talagang linalagnat kayo and you have the signs and symptoms possible of flu, and then possible of COVID, kina-quarantine na lang po talaga yon, ina-isolate po at tapos siniswab na talaga. So right now, even the best pulmonologist sa Amerika dito cannot tell you honestly, yung pa-check up ka sa akin, sasabihin ko sa'yo, hindi yan COVID, hindi ko kaya. And again, another thing, death rate. Hindi hamak mataas po ang death rate ng COVID sa flu. COVID, 2% talaga. Flu, it's very low. Hindi po ganun. At saka isa pa. Yung infectivity ngayon ng COVID. Sa flu, 'di ba, Reyna, you might hear na nahawaan ng flu yung isang tao, nakasama niya sa trabaho, 'di ba? You hear that, ay, nahawa ko ng flu dun sa pumasok kong office mate, nahawa ko sa nanay ko, nahawa ko sa asawa ko. Pero I don't think we have heard 7 people na na-flu sa isang bahay. Tama? Ako wala pa na akong narinig na gano'n.
Yes, wala pa naman
so what
po.
I'm trying to say is the exponential, the exponential spread of COVID, I haven't seen sa flu. At matagal na po akong doktor. I'm super old.
From Miss Ana York Evasco Beltran, hi Ninang.
Hi, Ana York. Kumusta na si Sam Sam? Sammy York yun. That's my inaanak.
From Miss Kathy Rodriguez, can you get COVID variant if you had COVID? Ang ganda po din ng tanong niya, Dok.
Talagang ano, pero magaganda. Ma'am Kathy, yes, you can get a COVID variant. If you have had COVID, yun nga yung sinabi ko sa Brazil. Yung UK po, tsaka yung South African, wala naman po tayo naririnig na ganon. But again, we don't know.
From Miss Marianne F.A. Mabuti, sa mga sinasabing asymptomatic, ano po ang dapat nilang maging guide na they are COVID infected para din na sila makapanghawa at makapag-self-quarantine na po sila? Stay safe po.
Naku po, yun po yung main problem of COVID spread. If you are truly asymptomatic or pre-symptomatic or you are in day 0 to day 4, talagang wala kang guide eh. Wala kang nararamdaman eh. So yun nga ho, that is the main problem why COVID has spread like it has. Kasi po, people are going around not knowing po that they are infected and then ano ho, eating, drinking, going around, doing their job, ganun po. And in the process, infecting other people. And then, suddenly, boom, day 5, may nararamdaman na po. So, yun nga yung sinabi ko, mami. It's either symptomatic, na talagang asymptomatic, talagang walang nararamdaman throughout the 14 days, or pre-symptomatic, walang nararamdaman from day 0 to day 4, and then, boom, day 5, lagnat. Pero, what happened between day 0 to day 4, naku, Reyna. Diyos ko.
Magkakaalaman.
Doon, magkakaalam.
Yes po. From Miss Cha Solis Pales, Doktora, ang isang family member ko, Doktora, positive po ang isang family member ko. Paano po ba ang first na gagawin po namin? Napakaganda
The
po ng
first thing that you should do, Ma'am Cha, is to remain calm. Okay? Kasi sometimes, and I hate to tell you this, na nakita ko na numerous times, huwag niyong itaboy yung tao. Yung iba halos tinapon na yung family member nila sa labas ng bahay nila. Yung iba nag-away. And really, some of the words na narinig po namin ay maaanghang through the text. Kasi pinadadala po sa asawa ko yung mga convo nila. Rain, you will cry. What I can tell you po, the first thing that you should do is to remain calm and compassionate. Remember, ayaw po ng tao na naging positive siya. Okay? Second thing that you should do is inform the barangay. Okay? Hindi po nakakatulong na itatago niyo po ito. Again, inform the barangay. The barangay will come po, lagyan niyo na po ng mask yung family member at i-determine po, determine po, depending po ng policy po ng LGU nyo, whether your family member can remain in your home or whether your family member should stay po in a government facility. Ako po, I am in favor po of government quarantine as long as malinis, safe, at maayos. Ngayon, kung hindi naman po ganon, talagang walang sasama. If you will advise to go to a government quarantine facility, sumama po kayo. Okay? Bring all your stuff, including your cell phone, your unan, and whatever they allow you to bring. Ito lang ang very important po. The persons in your house cannot assist you. Okay? Because they are now considered the close contacts and they cannot leave the house. Okay? So you have to call up another relative to assist the positive person to go to the government quarantine facility. Okay? And ano po, and quarantine doon. Ngayon, if you will be quarantining at home, okay, or isolating at home, that person needs to lock the door of the bedroom. Hindi po pwedeng, kung wala kayong bedroom, hindi talaga pwedeng doon kayo sa bahay, okay? Kasi magkakahawaan. That person needs to lock the door, okay? That person needs to open the window. And I hope the window naman ho opens into a garden, okay? Kasi kung if the window is straight to the kapitbahay, kawawa naman si kapitbahay. Okay? So lock the door and then that person has to stay inside there for 14 days. Kayo naman pong relatives have to stay in the house also for 14 days. Whether magpapaswab yung mga nasa bahay o hindi, okay lang pong wag na. Basta dun lang po kayo sa loob ng bahay. Okay? Meals. hindi po kayo pwedeng lumabas para mamalengke, okay? The barangay has to make palengke for you, or you can call your sister, your brother, your kapatid, your relatives. You leave the money po in an envelope, then they will make pamalengke, leave it outside your house, at yun po yung kakainin nyo. Going to Mercury Drug, not also possible. Somebody has to do it for you. You really have to stay there in that house for 14 days, and the positive person has to stay in his or her bedroom talaga for 14 days, and nobody must enter or go out. Okay? Mahirap talaga. But I'm hoping naman ho may support po yung inyong barangay. And ito lang what should you do if your kapitbahay is positive? O ikaw, Reyna.
Ako, inalam ko muna kung gaano kalayo. Kung gaano kalayo sa bahay ko. Ngayon, kung malayo naman, iiwasan ko yung street na yon. But then, kung positive at kapitbahay ko talaga, magsisimula na ako ding mag-isolate
Huwag
ng
ka na
sarili.
lang din lumabas ng bahay mo. Stay in your
Yes,
house na rin.
na lang.
I would agree with that. I would agree with that advice. Stay in your house na lang. If your kapitbahay, direct kapitbahay is positive, stay in your house. Okay? And then number two, ito, please respect that person. Wag Facebook ang una mong hahawakan. Nandito na po yung mga tanod, may dala-dala po, lilinisin na po yung bahay na aming kapit. Hindi ganon. Have a sympathy, understanding, compassion po. Kung wala na lang kayong maitutulong, keep quiet.
Malaking tulong na yung keep quiet, Doktor.
Malaki.
Napakalaking tulong na po nun. At saka
Yan. Ito pa.
yes.
Yeah, sige, Reyna.
Give them words of
Give
encouragement.
them respect.
Yes, opo.
Kasi next week, that could be you, okay?
Yes. So kami, yung isang street dito sa amin, Doktor, is totally lockdown.
Ayun ang
Bawal
mga,
lumabas. Yes. Which I am very much thankful to our LGUs kasi ganun yung palakad po nila dahil talagang mahigpit. Bawal lumabas ang isang street kasi nga may nag-positive doon. So bawal lumabas buong sambayanan doon sa street na yon. Okay, from Miss April Parinia. Good afternoon, Doktora. If nag-positive ka, symptomatic after 14 days nag-swab, possible ba positive ka pa rin? What to do if the case is like this? Thank you.
Ma'am, it's possible po that you would still be positive after the swab, after 14 days, kasi usually po remnants na lang talaga yon. Ngayon, kung talaga pong halimbawa, linalagnat pa po kayo, and you're still remaining to be positive, we have to, you have to go to the doctor po talaga and have a reassessment po of your case.
Okay, that's clear. From Miss Ednalyn Aquilon Rojo, Doktora, pag nawala po ba yung pang-amoy, automatic COVID?
Ma'am, hindi po. There are many reasons kung bakit po nawawala po ang pang-amoy ng isang tao. One of which could be actually a stroke. Another thing po, yung allergies, severe flu din po. Siguro let's put it together. Kayo po ba ay nilalagnat? Kayo po ba ay nanghihina? Kayo po ba ay nawalan ng pang-amoy at pang-lasa? Then most likely po, it could be COVID talaga. But could there be other reasons? Yes, there could be other reasons po. So, Ma'am Rains, we have to go in a few minutes. So, this will be our last question.
Yes. Okay, this will be our last question.
Don't worry, meron po tayo. Naman tayo every day. So
carry over po natin ulit. Medyo, Doktora, ang dami pang tanong, sobrang haba pa. Pero this will be our last question. This will be our last question. We promise, me and Doktora promise to carry over all your questions.
Opo. Huwag po kayo mag-alala.
Yes po. From Miss Juliet Vercacion Lico. Good afternoon po, Doc. Doc Ana, keep safe po para marami ka pa po matulungan. Yun na po ang ating last.
Okay. So sa inyo pong lahat, it's really a very dangerous time po and very worrying. Repost nga ako ng anxiety, Reyna, kasi talaga yung nervous level talaga ng mga tao, grabe. And you know what? may karapatan tayong maging nervous because the situation is not good. Di ako mambobola sa inyo to tell you na, de, okay lang yun. It's not okay. We need to do our part. The government will also do its part. So, kailangan po talaga tayong, we have to help the government. This is not alone sa Pilipinas, ha. Right now, there are surges in Italy, in Germany, in India. So, mataas pa rin po ang case po sa US. So, we're not alone. Pero, hindi ho yun yung rason kung bakit hindi po tayo kikilos. We have to help ourselves. Nobody else will help us except ourselves. Yung action po natin can help the family, can help you, and can help the entire Philippines. So, salamat na salamat po and God bless you po itong Holy Week na to. Thanks, Miss Reina. Thanks, everyone.